Well, good morning, everybody, and welcome to our February Community Impact Forum. My name is Cami Welch, and I'm the president of the Arvada Chamber of Commerce, and I have the privilege of kicking us off today for a very important discussion on mental health insights. There's certainly a lot to talk about. I see in the chat the reference to the importance of this topic, and we appreciate all of you joining us as we share the stage this morning with Jefferson Center for Mental Health and discuss all that we need to know about what's going on with mental health in our community. Before we get started today, I would like to take a moment and thank the elected officials and dignitaries who've joined us this morning. It's a long list, which goes to show the caring elected officials we have here in our community. We know this is a bit more challenging with Zoom, so if I miss you, please don't be shy about putting your name in the chat box so we can make sure we capture you. I know we have our Arvada Mayor, Mark Williams, with us this morning. From Arvada City Council, we have John Marriott, Arvada Fire Board, Bob Leverage and Jim Whitfield, Arvada Fire Chief, Mike Piper, Jefferson County Commissioners Leslie Dahlkamper, Andy Kerr, Tracy Krafthar, State Senator Rachel Zenzinger, Representative Brianna Titone, and from the Apex Board of Directors, we have Liz Tomsula. We are going to leave a few minutes today at the end to do elected official updates. That's something we did when we were in person, and we're going to bring it back today. So if you're interested in doing an update, if you're an elected official, please put in the chat. We don't have a ton of time, but if you can take a minute or so, we'd love to give you the stage to do that. So just drop in the chat that you're interested, and we'll call on you at the end of the session today. I would also be remiss if I didn't take a moment to thank all of the incredible sponsors that support the Arvada Chamber of Commerce. You can see them up there on your screen. We are so grateful for the continued support and engagement of these incredible business partners within our community. So thank you to all of you for your support. I'd also like to do a couple quick chamber updates. We are in survey mode right now as we move forward with this year. We want to make sure that we're serving you well. So we have a couple surveys you're going to see circulating. One around mental health that we'd encourage you to take. There's a workforce survey that you'll get the link for in the chat box here in just a moment. And then next week, we're going to be launching a COVID-19 survey just to see how everybody's doing and make sure that the programs and services being provided by the chamber and our partners are still in line with business needs. So I know that it can be a little overwhelming to take all these surveys, but it really does help us to guide the direction of our organization. We'll also drop in the chat our annual report, which came out last month. If you haven't had a chance to look at that, we'd encourage you to do so. Make sure you stay connected with the outcomes that we're attempting to drive collectively with all of you and our wonderful business partners. We are thrilled to be able to bring back the PPE distribution this year. So if you are a business that's not currently accessing that, please let us know. We know that that's a continued cost for your business, and we're happy to help support you with that. We're going to do something fun in March and launch a new campaign called Badass Women of Arvada. So if you know a woman who is a badass, that could be personally, professionally, working with nonprofits, we want to have her nominated. And so you'll see that form circulating here shortly. But we'd encourage you to nominate all those incredible women who are doing really great things for our community as we celebrate Women's Month in March. And then finally, we have an event coming up next week called Chamber Jumpstart. If you're a new member or you're looking to get more engaged in the chamber, this will be a great opportunity for you to hear more about how you can do that. What makes this organization so special is the level of engagement we have with all of our community members and businesses. And so we'd encourage you to make sure that you know exactly how you fit in that puzzle. So with all of that, certainly not a shortage of things going on, we're going to go ahead and get started today. I will remind you that at the bottom of your screen, you do have the Q&A box down there. We will have time for questions at the end. So if something comes up for you as we're going through this discussion, please put that in the Q&A. And then keep that chat activated. We do love to see your positive comments. I say this every month, but that chat box is intended to be a place to share good news, positive messages where we can all support each other. So please keep that flowing throughout the session today. I'm really excited about our two presenters that we have this morning, and I've been working with both of them for about a year now on the work that they're doing over at Jefferson Center for Mental Health, and it sure is impressive. And we know that they're doing a lot of work to understand what's going on in the community and serve our community in the best possible way. We have two panelists today, so I'm going to read their bios and then pass the torch to them to take it from there. First, we have Shannon Gwash, who is the Director of Wellness Services for Jefferson Center and is also a National Board Certified Health and Wellness Coach. She earned her MS from the University of Denver in Strategic Health Communications, Behavior Change, and her coaching education from Mayo Clinic. She is originally from northern Minnesota and currently resides in Evergreen, Colorado with her young daughter. To keep her own mental health in check, you can often find her hiking and camping with her daughter, writing, practicing yoga, attending concerts when those were a thing, and reading nerdy books. Last time I talked to Shannon, we talked a lot about Harry Potter, so I know that she is a good avid reader, which is fabulous. Our next panelist is Jessica Dunbar. Jessica is the Vice President of Business Development and Community Engagement at Jefferson Center for Mental Health. She holds a Master's of Science degree in Public Health from the University of Colorado and has over 17 years of experience working in healthcare. Throughout her career, she has dedicated her time and talent to expanding access to care, especially for vulnerable populations, and implementing transformational innovations in the healthcare sector to improve community health. Most recently, she served as the executive director of Every Child Pediatrics, where she led Colorado's largest safety net pediatric practice and expanded primary medical, behavioral, dental, and social services across 16 clinics. Welcome, Shannon and Jessica.
Hi, everybody. Thank you so much, Cami, for this incredible opportunity. I'm Jessica, and I appreciate this opportunity to talk about such an important topic, share about what we're learning at Jefferson Center for Mental Health with our community, trying to continue to be responsive to the needs and partner with all of you. I want to thank everyone for making this a priority to be with us, to learn together, to share ideas about what we can do to best serve the mental health and broader needs of our community together. So I'll kick things off here. Just in the way of background, I think some of you are very familiar with our work. For those that don't know a ton about Jefferson Center, we are a community mental health center. We've been serving Jefferson, Clear Creek, and Gilpin counties for over 60 years. And we provide a wide range of services, everything from wellness and prevention, early intervention work with young kids, throughout Jefferson County School District and other early childhood centers throughout our service region. We provide traditional outpatient therapy, substance use treatment, a wide network of peer specialists that have lived experience to help people in their journey of recovery. We have really grown our wraparound services because we know that makes a huge difference for people, helping them with employment and housing. We have a huge residential program with multiple sites to help people with those needs. Withdrawal management, we have a crisis center where we're taking calls all throughout the day, as well as it's a walk-in center for people that are in crisis that need immediate care. And then we help get them to the right level, whatever that looks like for them, and medication services. So that's a brief glimpse into what we do. It's very wide ranging. And we're serving over 30,000 clients a year. So Cami asked that we talk about, the impact of COVID in our communities. And I don't think anyone will be surprised to hear that, a lot of surveys, this data came from Kaiser Family Foundation and the American Medical Association, that we really are seeing the mental health and substance use needs increase. People are reporting difficulty sleeping, eating, more consumption of substances. And if they had underlying chronic conditions, those are worse now. And unfortunately, there has been a real uptick in overdoses. So, in terms of the Jefferson Center experience serving the community, we really have seen this play out in the last year. Children and families are presenting with more urgent and acute needs. We're seeing that in our crisis center. There's more calls and encounters with law enforcement. Again, people that are calling for seeking out outpatient services. People are presenting with more complex needs. I think that's the big takeaway right now. And our substance use treatment program really is, uh, we're receiving a lot of demand on that front too. And I'll talk about this a little later, working hard to expand that full spectrum of services, including residential treatment now too. Cami also asked that we talk about, the funding that came in to help us stay responsive during these challenging times. And we, as we kind of try to look at all of the different funding that came in from grants and government and our donors, our amazing community of supporters, we were able to raise over $127,000. And I want to thank all of you out here that helped us through your advocacy on the policy front, in the foundation community, local leadership. It really did help us. We needed to raise money to sustain critical services, make that rapid shift to a virtual model that we did in a matter of a couple weeks, like so many companies, and invest in not only that technology but also PPE and hazard pay. I wanted to highlight even what the city of Arvada helped us with over $36,000 to help us with our crisis services and paying our staff that were on the front lines responding day over day. We couldn't do it without all of you. It truly takes a village. So looking into the next year and beyond, there are still a lot of really important policy priorities that impact our ability as a community mental health center to serve the community. There are workforce challenges. There is a limited workforce of trained mental health substance use professionals. We're trying to recruit and fill these important positions, but it is a statewide challenge and a national challenge. So we're trying to be really creative with how we can recruit, retain amazing, talented people, and we have a strategic priority that we call radical redesign of services. We're trying to constantly be innovative with our team so that we can, combine everybody's expertise to make a difference, knowing that the workforce is limited right now. It's no doubt. I think it's the state. We're constantly looking to see how can we preserve state funding to sustain the work we do. Our biggest revenue source is Medicaid funds, and the state matches that with federal money, and so we're always looking to see that money can be preserved. And then beyond that, behavioral health is funded from a wide range of service sources that run through different state agencies, and so we're always trying to figure out how we can streamline that funding to make the most impact. So we're not only keeping an eye out on what's happening at the state level, the federal level, we're actively fundraising to stay responsive and pursuing some new business development opportunities. And I'll touch on that in a second. But we really are trying to diversify all of these sources of funding to stay sustainable and expand, knowing that the need is so great. Recently, there was funding, and I want to thank all of you elected officials that helped champion more funding towards substance use treatment. And we are about to open a residential treatment program. And we're really excited about that in a matter of a couple months because there's such a gap in the community in that area. So more to come there. We'll be announcing that shortly in terms of the opening event. And we've been also really looking at what are the needs of businesses right now. We did some market research the last couple of years, and we learned after talking directly with employers that there were common themes when we talked to CEOs, to HR professionals, brokers that partner with them, that there is a lack of employee engagement in EAP programs across the board, and that employers want to offer more wellness and mental health supports to their employees. They welcome having these experts like Shannon and I and the amazing clinical team at Jefferson Center and other community mental health centers to come in, partner, and talk about topics that are really important, that are on people's minds right now. How to deal with burnout, how to be a caregiver, and also, do a good job at work. I mean, there's so many things people are juggling and working through, and so we heard that from companies too. They're trying to figure out how to best support their employees through this, and there's a constant challenge of expenses associated with health benefits and trying to partner with organizations to pay differently for healthcare services to support employees and get more value for their money. So we really have taken those learnings to heart, and we're designing a new service line that we're calling Centered to partner directly with companies and offer wellness classes that are of interest to companies. And then if employees want to engage in therapy, we're building out a more direct pathway to that as an option. So more to come there. We're really excited to have this opportunity through the Arvada Chamber to share what's in the works, and we hope to get that launched in the spring or summer of this year. At this point, I'll hand it over to Shannon.
Thanks, Jessica. As Jessica laid out, there have been a lot of changes, both from an overall environmental perspective, from a work perspective, a family perspective, and as individuals. And so, we're 1 year into COVID. And so what is the new quote unquote normal that we're looking at? And what is this pandemic fatigue that so many of us are feeling? And so I'm going to go over some things about what is this feeling? What is pandemic fatigue? How do we sort of work against it? And a lot of that is work-life balance. So we're going to talk about routines, setting boundaries, and tiny humans. Although I've also learned that it's sometimes the bigger humans or the pets that also have some barriers to these things. And we're going to look at, everyone in this call is a leader. And so we're going to look at how do you support, your staff or your colleagues' mental health, and then the importance of self-care for leaders. And honestly, as I was putting these slides together, I'm realizing how much all of this goes together. So much of this is about self-care. So much of this is about taking care of yourself. And so there's going to be a lot of similar themes tied throughout my portion of this presentation. So what are signs of pandemic fatigue? The first one that I personally didn't really think of, as I was doing some research, though, it became very obvious, just less diligence around the safety measures. We know that wearing a mask works. We know that constant washing our hands and using sanitizer and social distancing works. But it's been almost a year into this. I think my last day in the office was March 13th, I want to say. So it's been about a year. And after a year, a lot of us are being a little lax with these things. Another symptom could be sleep, whether it's sleeping too much, not sleeping enough. This constant feel of exhaustion is sort of taking a toll. Feeling impatient and irritable. And this can be, again, with family members, just getting snippy and short with them. Can be with coworkers, friends. We're all sort of at this edge. There is more difficulty in concentrating and accomplishing tasks. There's a lack of motivation, sort of this low mood and feeling of depression, lack of motivation to do things both that you need to do for work, around the house, and even like the enjoyable things. And as Jessica also mentioned, there has been an increase in consumption of alcohol and other substance use to kind of, cope with these changes. And there is a line, we joked, many of us joked about it in the beginning of this was, having Zoom happy hours and all of these things, but the data is showing that has been a real issue, and that has really impacted so many of us, has been an increase in those things. So now that we know some of these signs, and I'm sure, as we looked over that slide, I bet every single one of us on this call has felt at least a couple of those things over the last year, if not specifically like the last couple of months when this has really started to wear on us, when me personally, and probably so many others, thought that this would be done by now. And here we are, still in it. So what can we do about that? One of the things that I like to first do is really like reflect on and accept feelings. I like to tell people, feelings are just feelings. They're not good or bad, and they come and go. And there is a lot of, potential detriment to having this facade of toxic positivity and just saying, yep, I'm great. Everything's fine. Everything's great. I'm fine. I'm fine. And in reality, you're not. And so there's so much benefit to being vulnerable and being authentic and just saying, you know what? I'm sort of having a crappy day. And using that with your coworkers and using that with your family even. I mean, I have a young daughter, as Cami mentioned, and there are times when I'm like, I just need a couple minutes. I'm having a really rough day and I can't do this right now. I need 5 minutes to take a breath, and then I'll come back and help you with your homework or whatever it is. And it shows this side of realness. Additionally, like connect with others. And again, this is this balance of, well, what does that look like? And we're all exhausted from staring at Zoom all day. And I don't want to stare at Zoom more. And I don't want to be on FaceTime. And yes, I miss my people. And so it's looking at, what else can this look like? Can this be, going safely for a walk? Can this be a phone call? Can this be just writing a letter? And feeling that connection to someone through snail mail. Everyone loves getting mail. That's not a bill. Stick to your routine. I think it's important that, we have morning routines and night routines. And though, some of this has changed a lot for us, there is importance to kind of sticking to a routine and sticking to some sort of, again, normalcy. A benefit of this is that I've given my daughter more chores to do because she's home more often. And it's now part of her routine that she has more chores to do. Be mindful of work-life balance. I'm going to go into more details in the next couple slides. Be active and move our bodies. I think that we have all lost the simple small movements we used to do. Most of us don't go to a walk from a parking lot to our office anymore. Sure, we all get up to go to the bathroom and make lunch and those things that we did in the office, but there's a much shorter distance for me to walk when I'm in my apartment than there is at the office. We don't get up to walk to other meetings. And though those may only be a couple minutes of walking or moving your body, it really makes a difference. And I think a lot of us are starting to feel the physical stress of sitting and staring at a computer screen all day without those breaks. So try to find like small ways to move your body. One of the things that I've done with my team, I do weekly supervision with them, just a short half an hour check-in. And we've stopped doing them via Zoom. And we do them over the phone, and we both try, whoever I'm doing supervision with, the clinician and myself both try to just go for a short walk, just to try to get up and get out of the house and get some fresh air. And it's been really helpful. The next one is limiting news and social media intake. I believe I heard someone call this doom scrolling, when you just scroll on your phone and look at bad news after bad news after bad news. So really try to be mindful and limit it. You can put, I have a time limit on certain apps on my phone. So if I spend, 30 minutes on Instagram, a little note will pop up that tells me I've spent enough time on that for the day. Turning off push notifications. I only have push notifications on my phone for text and phone calls. So any other app I have on my phone, it can't just pop up and interrupt my day. And then rediscover fun activities and create new traditions. So a lot of us have, had to stop doing the things that bring us a lot of joy. Like I don't go into yoga classes anymore. And so what does that look like? How can I still participate in that and take care of myself and my body? And, even though it looks different, how can I still engage in that? So if it's, doing videos or there's live Zoom classes or whatever it is, what does that look like? And also, create new traditions. There, for better or worse, with lack of options and lack of activities and lack of, opportunities for us to go meet with people, we are with, for the most part, the people in our home a lot more. So Cami is right. My daughter and I started reading Harry Potter books together, and I absolutely have fallen in love with them. I never read them or watched the movies till now, and it's amazing. And so that's something that my daughter and I do almost every night, is read a couple chapters, and it's been really fun. Another thing that I've gotten to do, I really enjoy cooking. And so being home so much more than having to be in the office has allowed me the opportunity to try out new recipes and do different things that I haven't been able to do as much in the past. And finally, again, looking at this, it's a lot of self-care, like taking care of ourselves, and we'll learn that really bleeds over into helping our staff take care of themselves and how we can be better leaders as well. So like I said, one of the big things with combating pandemic fatigue is really having a work-life balance. And so part of this is setting expectations. Set expectations with your coworkers and your family. A lot of times, my daughter goes to school up in Clear Creek. We live in Evergreen. And so she has been in person for the majority of this time. However, on the times where she's been home, I tell everyone right off the bat in meetings, I'm like, my daughter's home. So she might be coming in and out. When I've been in bigger meetings that I haven't led, you can see her sometimes asking me a question. And no one's gotten mad at me once. So I think really setting, that expectation, and people understand, no one, this is new and different for all of us. Letting people know the plan, again, whether it's coworkers or family, just really do it up front. One of the things that I did with my daughter last spring when she was working at home is I had this little, I had a stop and go sign where some meetings she could interrupt if something was, bothering her. And then some she couldn't. She had to figure it out herself or wait. And so we had a little stop and go sign. So she knew if it said stop, she's going to have to be patient. If it said go, then she had the okay to come talk to me if I was on a call. And also ask for help where you can, whether it's a partner or a family member that you're in close contact with, ask for help. This is not a time to be too proud to ask for help, I think. Make a workspace. I think that's huge. A lot of us in the beginning found, it was kind of fun to sit on our couch and work, or sit at our kitchen table and work, or, respond to emails in bed. But it really is helpful to make an actual workspace. As you can all probably see, I'm in my living room, which again, I'm home as a single mom. I'm home, my kid's in school most of the time. So it's not a big deal. I don't have interruptions. However, on the weekends, my desk is right in my living room. And so it's very difficult, or I should say it's very easy for me on a Saturday morning to just be like, oh, I'm going to get on my email for 10 minutes and just respond to those things I didn't get a chance to do yesterday. And inadvertently, 10 minutes turns into an hour. So I have to be really mindful about my space and what that looks like. But having a workspace does help sort of create this barrier between work and home life. Creating a schedule, having, again, going back to that little bit of normalcy and that routine of okay, my day starts here and it ends here, and knowing it looks different. My daughter gets dropped off from the bus around 4:00. So between 4 and 4:30, I walk down to the bus stop and get her, and I'm not around. And most of my coworkers know that. And I'll hop back online as soon as I get back with her and, finish out my workday. But for a brief stint at the end of the day, I'm not around. So it's creating a schedule and knowing when to kind of stick with it and knowing when to be flexible with it. I think that's really key as well. Kids thrive off routine, as I said. It's important for them, even if they are home, to kind of get up and be on their normal routine as if they were going to school. Get dressed, eat breakfast, brush their teeth, those basic things that we tend to sort of forget sometimes if we're just home all day and don't have anywhere to go. And help your kids with downtime. If you have a meeting or 2 meetings where you're like, I am not going to be around, you got to figure it out, set them up for success. Set them up for here's a coloring book. Here's your Legos, play with this. Here, do this. And use technology. One of my very best friends, who I think so highly of, I think she's a great mom. I think she is, to use Cammie's word, a badass woman who I would nominate but lives in Denver. And she said something about oh yeah, well, the kids get their movie time at 3:00 for the last 2 hours of the day. And I was like, they watch a movie every day? And she looked at me and she goes, Shannon, it's a pandemic. Relax. Because I tend to be very, very rigid with screen time for my daughter. And it just sort of this aha moment happened for me where I'm like, it's a pandemic, relax. 2 extra hours a day of screen time will not kill them. It will not hurt them in the long run. It'll probably be better for everyone's sanity in the long run, if nothing else. So don't be afraid to use technology when you can. Changing scenery, during both work and family times. Like I said, I have been trying to go for walks when I do supervision because it's just helpful to get up and get out and get moving. This lack of movement has led to a lot of chronic pain for a lot of us. Most of our home offices aren't set up ergonomically correct. And so it's really taking a toll on us. And also family times, if you can get out of the house for a little bit and go to a park or go for a walk or go for a bike ride or whatever you can do with your family, that's really helpful. And then the last two, again, it's really about being realistic. Be realistic with your coworkers. Things come up, plans change. The best laid plans often, are shot to hell during times. Be realistic with your family, your kids, your partners, and your pets. Pets have needs too. And so if your dog is like just whining and needs to go out while you're in the middle of a call, like you have to, be realistic and help take care of their needs too. And yourself. Like no one's perfect. No one is going to have it all laid out perfectly. And so just really be realistic and offer a lot of grace to everyone, in your life. And then make time for yourself. It's really about looking at all areas of well-being and self-care. And in terms of supporting staff, modeling that self-care behavior is going to be really helpful. It's going to be really beneficial to them. It's showing them that it's okay to not be okay. It's okay to, you don't have to have it all together. It's showing them that, you have empathy and that they can come to you when things are hard because you're understanding of it. Another thing with staff to help their, mental health and make sure that they're doing okay throughout this and they're okay, managing the pandemic fatigue is really having consistent times to communicate and really over communicating. I think in times of all of this uncertainty, people would rather have more communication than not enough. Because even if the message is, I don't have that figured out yet, there's not a decision yet, I don't know yet, at least it's something. At least you're being honest and upfront. And at least then they're not kind of creating these stories in their own mind about what might happen. And again, kind of the theme is just be flexible. Again, be realistic and flexible and give them some grace with what they need as well. When it comes to self-care, I apologize. I had a slide on this and then in the edits, I took it out. So you're just gonna not have a visual for this and I apologize, but there are 8 dimensions of wellness that we look at. And so it's your emotional wellness, your physical, your social, occupational, intellectual, spiritual, environmental, and financial. And yes, I definitely have notes that I wrote that down. Otherwise, I never would have been able to say that all back to you right now. So, it's really like looking at your overall wellness. So oftentimes when we think of wellness and we think of well-being, we think of, our mental health and our physical health. But it's really everything is combined together and everything works together. And it's a lot of like small changes can make a big difference. And so, if you're really looking at like, how can I take care of myself to better take care of, my staff, to better take care of my family, to better take care of the people that I need to help, it's the small changes. And I think during this time of this pandemic and during this time of change, even though things are starting to level out and things are starting to feel more normal and we're not in a crisis response so much as we used to be, there's still a lot of uncertainty and there is still a lot of change. And so it's making the small steps, creating a routine, focusing on your physical health around, sleeping and eating and moving your body, and also being mindful of your immune system. Stress takes a toll on your immune system, and there's so much going around right now that just really being mindful of it and taking your vitamins and doing what you need to do to keep your immune system up is also really important. Creating your workspace and connecting with others and being realistic and taking care of yourself. Those are all things, the small steps that will help you to be a better leader, be a leader more aware of mental health, your own mental health, and then help your staff as well. And I think that was us. So we can open it up. I will turn it back to Cami, and we can open it up for questions.
Awesome. So I'll go ahead and kick us off while our attendees get questions in the chat box there and in the Q&A box. So I want to talk a little bit about when should we be worried, whether it's in my employer life or in my personal life. What are some of those signs where we think somebody maybe isn't doing as well as they could be, and how do we respond to that?
Absolutely. That's a really, really great question. So oftentimes, when it comes to signs and symptoms, a lot of what I went over for the pandemic fatigue, those would be the signs and symptoms. And now this extra layer of, well, is this just the normal feeling? Everyone is, you know, everyone is feeling, or is this different? Is this more important? Is this something bigger? And I think, there are a lot of signs and symptoms, and part of it, again, looking at the overlap with the pandemic fatigue, it is, low mood, lack of motivation, communicating sort of this pessimistic attitude and this helplessness and hopelessness. It's looking at this uncharacteristic drop in productivity. Maybe you have someone who's a really high producer and all of a sudden they're way down, and they're just struggling to kind of get some of these things done. Another piece that oftentimes goes unnoticed is a lack of cooperation. I call the people I love working with the yes people. They're the people where you bring a problem and you're like, I have no idea what to do. And they respond with, okay, we'll figure it out. Yes, we'll figure it out. We'll work together. We'll do it. And maybe all of a sudden that person is not so willing to cooperate, not so willing to like go the extra mile, not so willing to, to do what they used to do. Maybe there's a little more conflict. Maybe they're a little more snippy. It's just pieces like that where it's a sudden change in behavior. It could be complaints around unexpected aches and pains. It could be signs of substance use if you're seeing substance use or abuse. So there's a lot that goes into it. And again, even if I always say it's better to be safe than sorry. So even, if you reach out to someone and you're like, hey, you just seem off, how's everything going? And they're like, oh, it's fine. I didn't sleep last night. Like, okay, well, it's better that you know that they just didn't sleep last night instead of something more serious that you could help them with.
So in the case that it is something more serious and you do have concerns that there may be something that they're dealing with, what is the employer's role in offering those accommodations that are needed? I think that's a really fine line for an employer to walk. What would you recommend to them in that situation?
I think that, a lot of times, because it is this, you're right, it is a fine line because you don't want to overstep and you don't want to assume and you don't want to offend people. And so I think that, when you approach your employee, when you approach your staff, really respect their privacy and don't make assumptions. So don't have this conversation if their partner's in the background or their kids are in the background or yours. Really respect privacy around this and then show compassion. Don't have a lot of judgment. And oftentimes lead with performance issues, because then that really puts it on the mark of, hey, you've missed your last couple deadlines. That's really unlike you. I just want to know how I can help you better meet these deadlines, or just see, how everything's going, if there's anything else I can help you with. And provide resources. So if you have EAP services, connect them to Jefferson Center, connect them to the crisis services. Those are all things that you can do to kind of, guide them and be gentle with them without coming across harsh or without coming across, accusatory, and things like that. I think there are gentle ways to have that conversation where you can show a lot of concern and compassion, again, without being judgmental or without being, assumptive.
I think that's good. And it actually ties to a question that Lisa asked in the chat box about stigma around mental health. What is the role that we all can play, as well as an employer, can you play in destigmatizing mental health?
Ooh, I love this question. Thank you for asking it. Honestly, it goes back to the whole piece about being vulnerable and open and authentic. I tell my staff all the time, it says on my calendar, on Mondays from 10 to 11, I have therapy. All of my team knows that I'm not around on Mondays from 10 to 11 because that's what I'm doing. I have been, so I think just acknowledging like having bad days, acknowledging that you're taking care of your mental health. The more open and honest, appropriately that you are with your team, the more likely they're going to say like, oh, okay, this person does get it. They're not just a robot, who's, a couple levels above me who just gets these things done. Like they're human, they have feelings, they struggle just like everyone else. And so I think the first thing you can do is really invite these conversations, have classes about mental health, offer mental health first aid, offer classes around employee wellness and well-being, that especially ones that touch on mental health. Like those are all things you can do. And as an individual leader, really be authentic with your team and show compassion and vulnerability around things.
I love that. That's awesome. Jessica, I'm going to kick a question to you, and I want to talk a little forward. So thinking about trends. So I know we've talked a lot about what are we seeing right now, but when you guys are thinking about your resources and trends as we move forward into 2021 and beyond, what are you thinking about and what should we all be aware of as far as what might shift or get worse or maybe better?
Oh, great question. We're actually later on today having a strategic retreat to talk exactly about that. And, I think at a really high level, nationally, as well as in the state, there are trends towards more value-based payment models. So uh, providers like Jefferson Center and physical health providers are partnering in new ways with insurance companies to pay for care differently. So beyond billing fee for service, there are different models that are, paying based on, the clients you serve, a monthly payment model, a per member per month type of arrangement, or as we're working more and more to try to measure the impact that we're having with our care models. So using validated assessment tools and scoring and looking at that over time to really show that symptoms are being reduced as a result of working with our care team and showing that value. And when you can show that that is making a difference over time with payers and saving money, so keeping people at the right level of care as much as possible and reducing hospital use, emergency use, that's more costly, of course, than where you can show savings, then pouring that back into direct service at the right level. So I'm really excited about that trend. I think another big trend is integrating services more and more to meet the whole needs of people. So we talk a lot about whole person care, and Jefferson Center is doing a ton of that, whether, with early intervention to crisis services, everything in between. But we have partnerships with over 30 medical practices throughout our community to integrate behavioral health alongside medical providers, so that when people go to see their doctor, we're reducing stigma by saying, what are your behavioral health concerns right now? Using these same screening tools to catch signs and symptoms early and connect people as easily as possible to care. So we're trying to go out where people are and help support those needs. So I think you'll definitely see more trends towards deeper integration to help people where they feel most comfortable.
Which is great. I know this week we heard statistics that 2020 was one of the highest death toll years for Colorado recently, and not all related to COVID. We know that. And so I think there's a lot of interesting conversations that I've been wondering about kids and how they're impacted long term with school being, remote for so long. And what does that look like? Are you seeing any trends specific to how people are responding and what we may see as long-term effects of what has happened in the past year? What do you think we're going to see related to that? And then just so your wheels can get turning, your next question is going to be around urgent policy issues. We're going to flip gears. So get ready for that in just a second.
Yeah, I mean, another big trend I also wanted to highlight is, preferring virtual care. So, we're all getting more comfortable with that. And we've been collecting more data throughout the last 12 months about, what are people's preferences and how does that vary by different demographics. So we know now that, it is harder with young kids to do therapy virtually. It's harder to engage with them. It's harder to get referrals. Um, we have seen a big dip with engagement of our youngest clients, which is really concerning. We haven't been able to be in the schools face to face with people and have eyes in the same way on these kids. And so we're really trying to figure out how can we get back face to face and nurture these relationships, have eyes on kids, and make sure that kids that really need extra support, we can connect with them quickly. So we're learning that face to face matters, especially with the young kids, and then those that are older youth, so teenagers, all through adults up to age 50. When we ask them, they enjoy virtual services, especially in the outpatient area. So sometimes people also like a hybrid. So they like to connect face to face at that initial appointment, and then they're more comfortable long term in a virtual model. So we're definitely adapting to that. And then older adults are telling us they're more comfortable on the phone. And so we're, supporting them over time to get more comfortable with technology. We have set up a number of kiosks with community partners. So those that don't have computers or don't have the right setup where they are, they can go to a community center where we have a partnership and just go into a designated room to engage in therapy in a private space. So trying to again be innovative with meeting people with where they're at. There was reimbursement for telephone, virtual, and in-person services throughout all of this, but we don't expect the telephone piece to continue. So we're trying to move quickly to get everyone comfortable with the options that we think will be part of the will continue even past the pandemic. So we're definitely learning a lot about preferences and how that impacts engagement in care.
No, I think that's important. And I would imagine there's some efficiencies in looking at
Yeah.
technology being a tool to be able to provide more care more efficiently to more people. So I think that's great. And I would love to stay connected on understanding what those trends are and what we all need to be aware of, because I think that's important that we all recognize there's new ways of supporting people that are going through a difficult time. So I think that's awesome. And I'm glad you guys were able to be so nimble and evolve. So we're going to do one more question, and then I'm going to invite in a couple of our elected officials to do updates to close us out today. So your last question is, what is that one urgent policy issue that needs to be addressed? You have a lot of incredible leaders and elected officials listening right now. What do they need to know about what you guys need to continue doing the great work you're doing?
Great question. Well, like I said, I think so much of our services, we really are able to make it happen because legislators have prioritized funding for mental health and substance use. And so that flows to us in a lot of different ways through Medicaid funding, through through a different arrangement, through our crisis services, through Signal Behavioral Health, the residential benefit that was added with the Medicaid program. All of those are huge. They make such a difference in our ability to deliver services and build out programs to meet the needs. So I would continue to just ask that. I know that people are making really hard decisions right now about where funds can go. And so being an advocate to protect that funding and continue to make it a priority is probably what I would say off the top of my head.
Okay, we got it. More money is always helpful.
Well,
to
and
make
even
sure that-
preserving what we can.
Yes, perfect. Well, thank you, Commissioner Dahlkemper, for that question. We appreciate it. Again, thank you everybody for joining us. Thank you to both of you for being such great advocates for mental health and great partners to this community as we go forward. I will invite in, and I'm not exactly sure how this works in the webinar platform, so I would love to hear from our esteemed mayor, Representative Brianna Titone, and Commissioner Tracy Kraft-Tharp will all be joining us for updates. Mayor, I see you in here, so if you want to go ahead and unmute and provide your update.
Thank you much. First of all, thank you to the presenters. Great job. Thank you to the chamber for having this kind of forum. So very, very important. In meeting with the commissioners, we're having a weekly meeting, commissioners, state reps, senator, with our health officials. And the news is really encouraging. And I just want to thank all of our citizens, our businesses for working so hard to play by the rules so that we can get back to normal. And we're getting there. And so it's exciting. That's an important update. And I just want to thank everybody for the cooperation with that to get us where we need to get going. An exciting thing in Arvada is that we have opened our bids for the next phase of the Ralston Road project. And because we've been nimble and because we've got our dollars in the right place, we're getting some really good bids. And we've been able to bid that project out for the next phase at a lower rate than what we thought we were going to have to pay, which frees up dollars for other things down the road. As you know, I'm part of the Metro Mayor's Caucus. We had an important meeting with Senator Hickenlooper this week. It's going to take a while to get used to that, but and him being a former mayor and a former governor, he gets it. And so we're working hard on pushing the efforts to get more federal dollars to cities and counties for both CARES Act type of things, but also for infrastructure needs. So we're pushing hard on that. And let me end on a sad note. As many of you know, we lost Jed Ladd on Valentine's Day. And typical Jed, he's going to pull something off so that it's always going to be remembered. But, I may be the mayor of Arvada, but Jed Ladd was the king. He was an icon. He was a great, great man. I'm working closely with his 3 daughters right now in terms of when we're going to be able to do a celebration of life. We may do something virtual to lead off, but eventually we'll get to that. And let me end with Jed's request in some of the papers he gave me was that he'd like to have a park bench along the Ralston Creek Trail. So Luann and I will be heading some fundraising to make sure that happens along with his wishes. And as you might expect, he laid out the song list for his memorial service. So things you might expect. So with that, I'll turn it back over to you, Cami.
Thank you, Mayor. Appreciate that. And certainly keep us posted on how we can all contribute and support that bench. That sounds really incredible. Appreciate your leadership on that. Next, we will hear from Representative Titone.
Thanks, Cami. This is such an important topic. Mental health has been really affecting so many people. And I just wanted to bring up a bill that I'm running with Representative Michelson Janae. And both of us have been real champions of mental health in the legislature since I've been there. And this bill that we're running is going to give people a mental health wellness exam. So everyone gets a physical, but we don't treat mental health the same way we do physical health. And even though in the federal government in 2008, they passed a bill for parity on mental health and physical health, but yet we still don't have that. So, we're proposing that, insurance companies and Medicaid offer these mental health exams for free once a year. And we're arguing that it's not a new mandate. This is a mandate that was imposed in 2008 when we said mental health should be parity with physical health. So we just want to make sure everyone's aware of this bill. There is this a new mandate? Is this not? But prevention is always going to be better than the cure, and we're always going to save money when we address these issues up front. So saving time, saving people from missing work, saving people from going into a crisis where they end up in an emergency room or worse. This is a really important issue that we need to get behind, because if the bill doesn't go through, it really sets a bad precedent for the rest of the country to do the same thing. So we need to make sure that we're really standing behind this concept and that we really want to fight for mental health for everyone and to have it as something that we should all have access to. So the bill is House Bill 21-1068. So take a look at that. And if you have any questions about it, please let me know. Easy to reach me. Just find my information on my website or ask someone. It's everywhere. So just want to bring that to everyone's attention. So thanks very much for your time today.
Thank you, Representative. We appreciate your leadership on that. That's incredible. All right, next up is Commissioner Tracy Kroft-Tharp. Oh, unmute.
I know, I just was saying brilliant things too. So hi, everybody. Good to see you all again. Thank you to the Center for Mental Health. You guys are amazing. I sit on the board, have a front row seat to seeing all the amazing work that they do. So thank you all very much. Want to recognize sitting in the back table is Commissioner Andy Kerr and Commissioner Leslie Dahlkemper, who have joined us today. So yay, good to see you all, you guys again. Just a couple quick things. One is the Public Health Department has welcomed a new executive director this last week, Dr. Comstock, and she, I'm sure, is scurrying around getting updated real quick, but maybe she could be somebody that could come in and visit with you all. I think we recognize that Dr. Mark Johnson was, really helped our community, did great work for us for, I think, 35 years, but we welcome our new leadership. So the city of Arvada and our public health department have joined together in partnership to do a vaccine clinic over at the Arvada firefighter training center over on Indiana. And they are working hard. They have finished up with vaccines for healthcare providers and are now on second doses. 63% of people in Jefferson County 70 and above have been vaccinated. 20% of the 65 to 69, and 7,000 educators were vaccinated last week. Our numbers are decreasing. 36 people were in the hospital on Tuesday, which we feel bad for those 36, but that's a drastic decrease in numbers. And then last, I just want to say last fall, the state legislature passed a bill to give money to our small businesses that are struggling. And so the county was reviewing those applications and the checks went out yesterday. And it looks like the state legislature could pass a second round of those. And want to give you time, Kemi, so that you could do your updates. So thank you all. Good to see you all again.
That was perfect. Thank you, Commissioner. We appreciate it. And with that, we are done for February. We will be back here next month, March 19th, talking about community growth. Lots and lots of conversations to have around that. So we hope you can join us next month. We will be virtual for the next few months, but we are scheming plans to get us back together in person. So we look forward to that moment with all of you. Thank you so much. Have a great weekend and stay warm.